Do you consider your foray into healthcare leadership accidental or intentional?
It was accidentally intentional, perhaps. so I started off pre med. I was pre med in undergrad. I went to Xavier University, Louisiana, and I wanted to be a doctor, but I was also really more interested in health policy. So I thought I needed an MD degree for people to take me seriously and wanting to fix the policies that surround how healthcare is like administered. As a child, I had asthma, so I was like in and out of the doctor's office and spent a lot of time just around doctors. And so, but I always intrinsically felt like there's something wrong with the way we access healthcare and the way that people are treated when they seek healthcare. But I thought I needed an MD degree in order to like foray into that area. So I was focused on that primarily for a bit. But then Hurricane Katrina hit my senior year of college, and that was completely devastating to say the least. I think people heard a lot about how Katrina impacted the city and impacted the residents, but much less was discussed about how the hurricane impacted college students. New Orleans, in particular, was a huge college town. And so that really impacted me a lot. And what I ended up experiencing was the social determinants of health, though I didn't know what to call it at the time, but all of the broken infrastructure that led up to not only the natural disaster, but the man-made disaster that happened thereafter are all rooted in racism, but also rooted in the social determinants of health. All of those things I didn't exactly know how to name in the moment, but they had a deep impact on me. And so I did apply to medical school twice, and I got rejected twice, which is not uncommon. But somewhere along the path, I realized maybe there's something else I should be doing. And in all that time, I'd been working in clinical research. So after I graduated from college, I ended up working in clinical research and working as a research assistant, clinical research coordinator, and eventually pursued a path that was kind of in line more with that. And that took me to grad school, and it was accidentally intentional, I guess. I think that I always had some ideas of how to fix the broken healthcare system, but I wasn't quite sure I would be a leader in this sense.